Hello, my name is Dr. Elliot Hirshhorn and I'm going to welcome you here to today's video. I want to congratulate you first of all for taking the time to even watch the video to learn more about the condition that you're suffering with. You're probably watching this video because either you or someone you love is suffering from something called peripheral neuropathy. In the video today, we're going to talk about what that is. We're going to talk about the standard medical treatments for it and why they don't work. We're going to talk about what we do in our office and how it addresses the exact underlying causes of the neuropathy, and so therefore it allows us to get great results in terms of improvement in symptoms and most importantly improvement in our patients' quality of life. So welcome to our talk today. It's called Functional Neurology and Functional Endocrinology for Peripheral Neuropathy, and I'm Dr. Elliot Hirshhorn. Let's go ahead and get started. So most patients, when they get into our office, are suffering from a chronic condition. What that means is you've been dealing with the symptoms for more than 6 months. For chronic conditions, the traditional medical model really doesn't have a whole lot of great answers. So what we're going to talk about today is really going to help you to address the frustration that you've been dealing with. And that's what we find in a lot of our patients. They're really just frustrated because they're not getting the answers to the questions that they're asking. What we're going to talk about today is going to change the way that you think about your peripheral neuropathy, and it's going to offer you hope because we see great improvement in not only the symptoms, but also therefore in your quality of life when we address those. So there's hope. Please continue to watch the video all the way through. You're going to learn a lot of great information. And if you like what you hear, I'll talk at the end about how you can set up an appointment in our office so that we can figure out whether or not you're even a candidate for what we have to offer here. What the plan is for the videos, I'm going to talk about what we do. I'm going to talk about how we're different from the standard medical model, and you'll hear me compare and contrast what the standard medical model is to what we do here in our office. And I want to encourage you that we really leave no stone unturned, and you'll see that as I discuss the program that we offer here. I'm going to talk about what neuropathy is, what causes it, how we help it, and at the end, as I said, I'll let you know how you can make a one-on-one consultation here in our office. Again, my name is Dr. Elliot Hirshhorn. I'm a board-certified chiropractic neurologist, one of 3 in the entire state of South Carolina at the time of this recording. I practice functional neurology and functional endocrinology, or functional medicine. If you're not familiar with those 2 fields, then you will be very familiar with them by the end of the video. What we find is that when we combine those 2 fields, however, we get the best results for our patients. And that is my goal, is to get you results in the issues that you bring to our office because we want to help you to improve your quality of life. Okay, enough about me. More importantly, who are you? As I mentioned, all the patients that we see in our office have a chronic condition. You've been dealing with it for at least 6 months, most likely years and years and years, and you're not getting the solutions that you want to the chronic condition, and that's why you're watching the video. I want you to think of 2 things that you could either do or stop doing that might help to improve your chronic condition, that will get you back to a point of optimum function, and when you are functioning optimally, then your symptoms go away and you have a better quality of life. What 2 things could you do or stop doing to make that happen? Now, probably the first 2 things that come to mind are not, I need to take more medications. And you think that, you don't think to take medications because that's not an instinctive way that your mind feels like you can get back to a better functioning way of life. To be physiologically optimally functioning, you don't need more medications. I want to read you this quote. It says, "Modern medicine is excellent at providing care for acute diseases, for things like strep throat, acute bronchitis, pneumonia, urinary tract infections, surgical emergencies. The medical system, however, lacks an understanding of and treatments for a myriad of chronic diseases." This is a quote by a medical doctor who works in that environment and understands that, yes, if you have a broken bone, if you have a heart attack, if you have a stroke, if you have an acute infection, the medical system, the way it's set up in the United States, is the best place in the world for you to get care for those issues. He also recognizes, however, that if you have a chronic condition for things like peripheral neuropathy, thyroid disease, diabetes, autoimmune diseases in kids, neurodevelopmental disorders like ADHD, these are all common chronic conditions. In the medical system, their therapies, their treatments are very ineffective in the long term because they're not addressing the actual underlying root cause of the problem. What we do in our office is to identify the actual cause of the issue and address that specifically, and when we do that, we get very significant improvement in patients' quality of life. So if you want help for your chronic condition, we have to step outside of this traditional model. The medical doctor I just quoted said their model doesn't have the answers for that. What I'm going to talk about today are the answers that we have for peripheral neuropathy, and you'll see that we get great results with that. So we have to step outside of this traditional medical model. I'm going to represent the traditional medical model with this box today. The traditional medical model, all the things that are offered for peripheral neuropathy are inside this box. Usually it's medications. This box and the parameters of what's available for peripheral neuropathy in the traditional medical model are really dictated by the insurance companies and the pharmaceutical companies. The pharmaceutical companies do the research, they create the medications, they limit what is available to you. The insurance companies limit access to testing and the drugs based on whether or not they're going to pay for it. So when we step outside of this box into what we're going to be talking about today, what we do in our office, even though it gets great results, because it's outside the parameters of this box, there is a financial investment that you have to make. Most commonly, insurance companies do not cover what's outside this box, even if it does get great results. So I just want to let you know that up front, but I will talk at the end about what the different costs are and what you can expect. So please watch the video all the way through. I just want to be transparent up front with you and let you know that what we do in our office is usually not covered by insurance because it's outside of the traditional medical model. So you have to make a financial investment. And I want you to think about this in another way. Let's say you are eating at a restaurant, you've been eating there 10, 15 years, you go back week after week, you've gotten to know the owners at the restaurant, you know the patrons, you really enjoy yourself. So every Tuesday, let's say at lunch, you go to the restaurant and you get your food. You've become very good friends with the owners, so now they've done a really nice thing for you. They allow you to go and eat for free. So every week, Tuesday after Tuesday, you go, you have lunch, you don't have to pay for it. All of a sudden, however, in the past couple of months, after you eat, you've been feeling sick. The food is doing something to your system, and it's not a good thing. You're cramping, you're bloating, maybe you're nauseous, vomiting. So you have a decision to make. Do I keep going to this restaurant because it's free and deal with the consequences of not functioning well and feeling bad, or do I make a decision to go another route, go to a different restaurant, make a financial investment, take another path that's going to lead me down to improved health and improved quality of life? That's really the two choices you're going to have to make, or the two choices you have in the improvement of your quality of life in regard to peripheral neuropathy. You can continue down the traditional medical model, but it's not really doing what you want it to do in terms of getting you better, because if it were, well, let's be honest, you wouldn't be watching the video. What we offer here in our office, it's outside this box, so it's not covered by insurance in most cases. So there is a financial investment that you have to make, but we're talking about your health here. So the financial investment, if it's going to get you the improvement that you're looking for, in many cases, most of our patients usually say it's extremely well worth it. So let's go ahead and continue. The good part about this is that I'm not beholden to any pharmaceutical company, so I don't have a drug rep coming into my office buying me lunch, doing this and that, saying, here, give your patients this medication. I'm completely independent in that regard. And I don't have an insurance company telling me, hey, you can't order this test. We're not going to pay for it. The only person I'm beholden to is you. If you hire me as your doctor, I'm going to do the absolute best job I can for you so that I can get you better. I'm going to order the tests that you need. I'm going to recommend the therapies that you need as an individual to get you your quality of life back. And we can get you better, but if I don't think you're a good fit for our program, I won't even let you into the program. We won't accept your case, so we won't waste your time, we won't waste your money if I don't even think it's going to be a good fit for you, so you can have comfort in knowing that. So what is peripheral neuropathy? What causes it? What can be done to restore these peripheral nerves to health? These are the things that we're going to be answering in the next couple of minutes. Peripheral neuropathy, first of all, is extremely common. A lot of people don't even realize the onset of it because it is gradual, it is progressive, and it is slow. So over time you start to lose the feeling in your feet and your toes and your hands and your fingers. You get some tingling and then numbness, and it can eventually lead to burning and pain and things like that, but it's a very slow progression, so oftentimes people don't even realize it until it's very far progressed. It's a chronic disease. It affects over 20 million Americans. And basically what's happening is your nerves, which are your electrical wiring, it's really starting to break down. They're degenerating. They're not healthy, so they're not functioning properly. What also happens is the information coming from your hands and your feet normally goes up to your brain and stimulates it or activates it. That's one of the things that keeps your brain healthy, stimulation and activation. So if you're not getting that information from your hands and feet, it can lead to degeneration and dysfunction in the brain as well. And it can also lead to problems with balance and coordination and memory and things like that. The brain then can't communicate with the hands and feet either. So it can't go up, the information can't go up, the information can't go back down. So that leads to those balance and coordination type of issues as well. So what does peripheral neuropathy mean? Peripheral means further outside of the body, distant from the brain and the spinal cord. So you have a central nervous system, brain and spinal cord. You have a peripheral nervous system, all the nerves coming out from the spinal cord, going down to your limbs and your hands and your feet. Neuro means nerves, pathy means abnormal. So abnormal function of the nerves is really what we're talking about in the periphery, the outside, far away from the brain, in your hands and your feet. The 10 signs of peripheral neuropathy: numbness, extremely common, burning in later stages, cramping, sharp electrical pains, pain when walking, difficulty sleeping because your legs are hurting all the time, prickling, tingling of feelings, loss of balance and falling, weakness, swelling. Loss of balance and falling, this is extremely important. Remember I was talking about you don't get that information up from your feet to your brain, so your brain doesn't know where you are in space. So that leads to balance and coordination and clumsiness and falls. Falls are the #1 cause of accidental death. As you get older, you hear this happening more and more. We obviously don't want it to get to that point for you, so we can work on this before that becomes a problem. The symptoms depend on what type of nerve is affected. If you didn't know that, you have different types of nerves in your body. The 3 main types of nerves are ones that carry sensory information. So that's things that you can feel consciously and also unconsciously. Actually, most of it is the unconscious sensory information that goes up and tells your brain what's going on in your environment. The stuff that you actually feel, like pain and temperature and vibration, that's actually only a very small percentage of all those nerves. Then you have nerves that control muscles. So that comes from the brain back down the spinal cord out to the muscles, and that controls the movement of your muscles. And then there's autonomic nerves. These are the ones that unconsciously, it's involuntarily control a lot of different things, but one of the big things is it controls blood vessels, and the dilation and constriction and blood flow is regulated by the autonomic nervous system. So the symptom that you experience depends upon which one of these things is affected. With peripheral neuropathy, one of the big things is the sensory stuff. So you have the pain, the numbness, the tingling. Those are the common things, but it can also impact motor function, so there could be weakness in the limbs. And this is where you probably wouldn't even recognize some of these things. The autonomic control over blood vessels and digestion and heart rate and all those things, you may not even connect to the fact that you've got a nerve problem, but those things are regulated by your autonomic nervous system, and when these nerves are not functioning well, it can cause dysfunction in those areas of the body as well. So let's talk about the sensory changes. When you have damage to the sensory fibers, it's going to result in changes to the sensation and what you're feeling. You've got burning sensations, you've got nerve pain, tingling and numbness, an inability to determine your joint position. So one of the tests that we'll do when you come into the office is we'll move your joints around and see if you can recognize which way the joints are moving without actually looking at them. You'll be surprised to find out that you probably can't identify that if it's fairly far progressed along. And this can cause balance problems, because when your brain doesn't know where your hands and feet are as you're walking, unless you're looking down at your feet, your brain doesn't know where they are, and so that leads to problems with balance and walking. For many of the neuropathies, the sensation changes often begin in the feet and then progress towards the center of the body, and then it involves other areas as the condition worsens. And so, for example, with diabetic neuropathy, which is one of the causes of neuropathy, what happens is those nerves die off, the tissue dies off, and that's one of the reasons why diabetics in stages end up having amputations. It's the #1 cause of preventable amputations is diabetes and the neuropathy that results from that. You can also have movement difficulty. So when you damage the motor fibers, it interferes with muscle control, can cause weakness, loss of muscle bulk, so atrophy, the muscles are getting smaller, loss of dexterity, so control over fine motor movements like writing and handling objects. and sometimes you can have cramping as a sign of motor nerves now being involved. All chronic health conditions have very common threads. So you can see peripheral neuropathy, thyroid conditions, diabetes or insulin resistance, fibromyalgia, vertigo, sciatica, chronic fatigue, hypertension, chronic pain, irritable bowel, insomnia, migraines, headaches. They all have metabolic and neurological imbalances, and that's why we address both the neurological and the metabolic component of all of our patients. So metabolic imbalances could be anything from anemias to chronic inflammation, blood sugar issues, adrenal dysfunction, hormone imbalances, autoimmune attacks, hidden infections, food sensitivities, side effects from medications. So if we don't look for and find whatever causes are in these areas, we won't know whether it's having an impact on your chronic condition like peripheral neuropathy. From a neurological standpoint, we're looking to see if the brain is functioning on all 6 or 8 cylinders, so to speak. When we do that by a functional neurological exam when you come into the office. Chronic illnesses, therefore, are a combination of both the neurologic and the metabolic component. That's why we address both of those things. When we find the actual causes in those components, we address them and we get the best results for our patients. So it's anywhere from a 60-40 to a 50-50 component in terms of which one's causing more of the issues. When we're looking at a neuropathy like peripheral neuropathy, there is more of a neurological component, but the causes of those neuropathies can be metabolic as well. So what is metabolism? Metabolism is simply you eat food and it creates energy. It's extremely more complicated than that, but that's the basic gist of it. You eat your food, it gets converted to energy. That's metabolism. So let me ask you a question. 30% of our energy goes to which system? What do you think it is? Is it the endocrine system, the digestive system, the nervous system, immune system, cardiovascular system? It's actually the nervous system. Even though the nervous system, if you cut it all out and weight it, is only 2% of your body weight, it takes up 30% of the energy. So we need proper metabolism in order for you to have properly functioning brain and nerves. So if we don't look at the metabolic component, we're missing a huge piece of the puzzle when it comes to the neuropathy. Metabolic problems very commonly lead to peripheral neuropathy. So if you're only addressing the nerves, you're missing the boat. So what are the leading causes of neuropathy? There's a whole bunch of them. We're going to go through these step by step. Things like statin drugs, damaged low back, diabetes, chronic inflammation, chemotherapy. All of these can contribute to neuropathy, and you can have multiple of these going on at one time, leading to the neuropathy that you're experiencing. So let's talk about the first one, leading cause, statin drugs. What are statin drugs? Statin drugs are supposed to lower cholesterol. The statins inhibit the production or formation of that cholesterol, so it lowers your overall cholesterol. Now, cholesterol is actually extremely important for your body's normal function. It makes up the surrounding coating, the myelin sheath that surrounds your nerves, which is important for proper function of those nerves. So if you decrease cholesterol too much, it can actually cause problems with nerve conduction, nerve function. So that's what happens when you have these statin medications. It lowers cholesterol. The nerves lose their integrity because they don't have that outer covering as much as it used to. Statin drugs also inhibit the formation of the CoQ10 enzyme, which is necessary for proper nerve function. Statin drugs are the leading cause of peripheral neuropathy. Now, cholesterol, the reason why you're on the statin medication, and a lot of patients that come into our office are on statin medications, cholesterol is actually, based on the studies, a really poor indicator or a risk factor for cardiovascular disease based on the research. And actually a better marker for cardiovascular disease is the ratio of your triglycerides to your good cholesterol, your HDL. And when that ratio is above 2 to 1, that's when you have problems, not really the total cholesterol. And so all of these medications came out about 25 years ago, and they're beating up on cholesterol. You got to lower cholesterol, got to lower cholesterol. And the drug company said, hey, we're going to eradicate heart disease in 25 years. Well, it's been 25 years, 89 to 2014, and we still have all the heart disease. And why is that? Because the cholesterol is not the cause of the heart disease. The cholesterol will never stick to the artery walls unless you have inflammation. So inflammation is the cause, and then when you've got the inflamed arteries, then the cholesterol will stick to it. So a study from the journal Neurology in May 2002 said that statin drugs, cholesterol-lowering drugs, increase the risk of peripheral neuropathy 16 times, or 1,600% increased chance of developing neuropathy if you're taking a statin medication. Let me give you an analogy. Let's say you've got a bunch of rats outside your house and they're all around the trash. Okay, your trash is kind of spilled over, rats are running around, and so every day you go out there and you get rid of the rats. You set traps, you get rid of the rats. They keep coming back though. Why do they keep coming back? They keep coming back because the trash is still there. So you got to clean up the trash and get rid of it, and then the rats won't come around anymore. Well, that's what's happening with cholesterol. The inflammation is in your arteries, and so the cholesterol hangs out there. It builds up, and then that leads to heart issues. So rather than getting rid of the cholesterol, let's work on the inflammation. If you get inflammation down, then the cholesterol won't hang out in the arteries and clog them and cause heart issues anymore. It's really important to address causes of issues and not cover up symptoms simply by taking a medication. So why has heart disease gone up dramatically since statins came on the market? That's because they're not addressing the inflammatory component of it. All they're doing is getting rid of this cholesterol, which is having an impact on nerve function, because you need the cholesterol, not only for nerve function, but for also, cholesterol is a precursor molecule to a whole bunch of different hormone production. So it's impacting hormone regulation and production. Why do countries with chronically high cholesterol have lower heart disease? Because it's not the cholesterol, it's the inflammation. So they have lower inflammation even though they have higher cholesterol, and therefore they don't have as much heart disease. And then why do just as many people with low cholesterol die from heart attacks as people with high cholesterol? And that is in the literature. There's no difference in dying of heart disease whether you have high or low cholesterol. And the reason why is because it's not the cholesterol, it's the inflammation that's causing the problem. So again, get rid of the trash. Don't try to get rid of the rats every time. Get rid of the inflammation. Don't try to get rid of just the cholesterol. So the take-home message, cholesterol will never clog your arteries unless you are inflamed, and you need cholesterol for proper nerve and brain function, as well as a whole bunch of other things like hormone production and regulation as well. It's also the main component of your cell membrane, so the little coating on the outside of your cell is made up mostly of cholesterol. It's extremely important. Number 2 reason for peripheral neuropathy is damaged lower back. So you can have things like stenosis, degenerative or bulging discs, degenerative arthritis. They all have one thing in common. And what happens is it places irritation or pressure even on those nerves in your low back. And when you have irritation or pressure on those nerves, it's going to impact the signals going back and forth in those nerves. What signals are going back and forth? We talked about it already. Sensory changes, motor changes, autonomic changes. Sensory is the one that you'll probably notice the first: numbness, tingling, burning, pain. So if you have a low back issue, that needs to be addressed specifically in order to take care of that component of it. Can you be on statin medications, have low back problems? I see it all the time, of course. So you have to work on the metabolic component with the statin medications and address the low back complaints at the same time. If you don't address both components, which most programs out there do not do, then you're not going to have very good success. Okay, let's look at the next common cause, and that is diabetes and insulin resistance. Let's talk about the fact that your nerves need an incredible amount of energy. We mentioned before that 30% of all the energy goes to 2% of your body mass, and that's your nervous system. Glucose, sugar, is the form of energy that your brain readily uses. Insulin is the hormone that pushes the glucose into your cells, in particular your nerve cells. When you're diabetic or you're insulin resistant, which is basically pre-diabetes, glucose can't adequately get into the nerve, and the nerves get fatigued. When your nerves are fatigued, they don't have enough energy, they don't function well, you end up with different types of symptoms like numbness and burning and pain. Muscles are weak, they're tingling. So blood sugar elevation, insulin elevation, that causes more inflammation in your system. Not only are the nerves not functioning well, but now you've got all this inflammation. Well, what is inflammation? That's basically like having a blowtorch inside your blood vessels, inside your nerves, destroying everything. You can't build a house if it's on fire. This isn't going to work very well. Same thing inside your body. If it's chronically inflamed, things are not going to work well. All the chronic conditions, their number one driver is inflammation. So a lot of the things that we deal with in our office, other chronic conditions, thyroid disease, autoimmune disease, ADHD, there's a lot of chronic inflammation underlying there that needs to be addressed. Basically, it means to ignite, and if this is what your body looks like, it's not going to be functioning very well. You're not going to be feeling very well. Your quality of life is going to be not so good. Common causes of inflammation that contribute to peripheral neuropathy. Number one, food sensitivities and inflammatory foods. So there are certain foods that are just generally inflammatory that you need to stay away from. There are also foods that each person individually is sensitive to, and you may not even be aware of it. The most common food sensitivities are things like gluten, dairy, egg, and soy. And you could maybe eat those things, not have any gastrointestinal complaints, and still have an underlying immune inflammatory response every time you eat those that's driving the chronic disease that you're dealing with. So it's really important to find out what foods that you're sensitive to. It's completely different from a food allergy, like a peanut allergy where you break out into hives and you can't breathe. That's totally different. A food sensitivity is a gut response that results in systemic, all over your body inflammation that causes a lot of problems. You can have hidden gut infections that lead to inflammation. Poor ratio of omega-3 and omega-6 fatty acids. It should be about a 1-to-1 ratio in the standard American diet, abbreviated SAD or SAD. The ratio is about 25-to-1, 6 to 3s. High insulin and blood sugar drives inflammation. Hormonal imbalances drive inflammation. So we have to address these drivers of inflammation, because if we do not, as one of the components of the therapeutic program we do, then we're missing, again, a piece of the puzzle, and we're not going to get the results that we see. So when you come into our office, we're going to say you need to make significant changes in your lifestyle. If you're not ready and willing to do that, then it's not going to be a good fit for you. We won't even accept your case. So if you're not willing to make those changes to feel better, I can't care more about you than you care about yourself. If you can't make that effort to do that, you're not going to get better. I don't want to waste your time and money in that regard. So, don't even make an appointment if you're not willing to do those things. Metabolic causes have to be addressed if you're going to win the battle against peripheral neuropathy. The first way that we address metabolic issues is to get a baseline read on how your metabolism is functioning. We do that through comprehensive blood work. Our comprehensive blood panel has about 60 to 70 different markers in there. We're looking at short and long-term sugar levels through fasting glucose, fasting insulin, hemoglobin A1C. We're looking at a thyroid panel. Not everybody has thyroid issues, but sometimes you can have normal thyroid tests that your medical doctor orders in that traditional medical model. The TSH is normal, and then all the other components of the thyroid panel that are typically not ordered but we order, they come back as showing an issue, and I've seen that before in the past. Lipid panel, so good and bad cholesterol, triglycerides, this is important with the peripheral neuropathy. Maybe your cholesterol is too low because you're on a statin medication. That needs to be looked at. Maybe your triglycerides are too high, your HDL is too low. We find that very common when you have an insulin resistance, blood sugar issue, diabetes. We see that come up. Complete blood count, good red blood cells, white blood cells, tells us about anemia or oxygen deficits, tells us about potential infections. Electrolytes tell us whether the liver, kidney, adrenals are functioning well, vitamin D, and we have a huge inflammatory panel. We're looking for different markers that are elevated or lowered when you have chronic systemic inflammation. Inflammation, inflammation, inflammation. It's like in real estate, location, location, location. Chronic diseases, it's inflammation, inflammation, inflammation is extremely important. There's a lot of other components, but if the inflammatory issues are not addressed, you're just not going to get better. This is a panel that we recommend. We're probably going to recommend it when you come in for your first appointment. A panel, I'm going to go over it right now, the costs with you. I told you I would go over costs. I like to be upfront and honest about those things. And just let me tell you off the bat, if we were to send this panel with these 60 to 70 different markers to LabCorp and try to bill it through your insurance, they will bill it at the retail rate. It's over $1,950 as of 2013. If your insurance company says, no, we're not paying, they're going to send you the bill for $1,950. That's because some of those tests are outside of the traditional medical model. They are very comprehensive in our model and are extremely important. That's why we order them. But because they're outside of that medical standard of care, they may not cover it. So they'll send you that bill. So we don't even do it that way because I don't want you to end up with that type of situation. So what we do is we have a direct relationship with the lab. We get a significant discount. It's $299 for this comprehensive panel. We can email you the list of those tests if you're interested in that. If not, I'll just show it to you when you come in for the first appointment. And what happens is we'll order that $299. If you want to submit that to your insurance, great. If they cover it, fantastic. If not, you're only out $300 versus the whole $1,950. It's extremely important. This is how we start to address those metabolic issues. Now, when we look at those test results, we look at them differently than the traditional medical model looks at those. In the traditional medical model, these lab ranges are really, really wide and broad and inaccurate. What happens is they take the average from the population that got their lab work done the previous year, and they statistically stretch out those ranges so far so that literally 99.8% of the people fit inside that normal range. And who goes to the lab? Sick people or healthy people mostly? Mostly sick people. So most of the sick people are falling within these normal ranges, and we're not picking these chronic diseases up until they become really huge issues. So it's important to look at what we call functional ranges, where we narrow that range down, and now we're looking at healthy, optimally functioning people and comparing you to that standard rather than a standard of not so healthy sick people. Here's what that looks like graphically. So let's say, for example, blood sugar. We're looking at about 85 to 99 or so, give or take. If you're below 85, you're in the hypoglycemic range. If you're in 99 or above, you're in the hyperglycemic or diabetes insulin resistance. Now, the low end on that for the traditional medical model is going to be 65, so you have to go really far low before they show that you have a really serious problem. In order for you to have, actually sometimes this goes up to 110 in the medical model. So you have to go all the way to 110 before they're going to say, hey, we have a problem. Where we find a lot of people is they're in this yellow zone where your doctor's going to say, if you land in here and you're really close to that line, they're going to say, well, you're normal, we can't do anything for you. They wait for you to basically fall over that cliff there, that arbitrary line that's based on all these sick people, until they start to address the problem. So functional values are much more accurate. They allow us to pick up things with a lot more sensitivity so we can address them before they become huge issues. It's like you're about to fall off the side of the cruise ship, and with our functional ranges, we're going to say, hey, you're about to fall off the cruise ship, here's a life preserver. Whereas in the medical model, their ranges are so wide, they let you fall off the ship before they send you any help. It's a huge problem. We're using the lab ranges there. So we look at them differently. Here's another way to look at it. Functional ranges for glucose, 85 to about 100. Traditional, 65 to 110. And so when you fall inside these traditionally high and low ranges, it doesn't give us much sensitivity in identifying different issues. And so when we use these lab ranges, in fact, when we get your lab work back, we put it into our functional blood chemistry software, and you're going to get a detailed report outlining all of the functional issues that we've found, and I'll go over that in detail with you when you come back. We do additional testing depending upon the individuals. We're not going to order all this on everybody. It's just based on what you present with in terms of symptoms and what the other blood work shows us. That guides us in additional testing. We might need to do immune panels, adrenal panels, hormones. We can test for chemical sensitivities. We can test for food sensitivities, gut pathogens, leaky gut, genetic testing, neurological testing I do on everybody. That's when you come into the office and I do a functional neurological exam. I'll talk a little bit more about that in a couple of minutes. But we have very extensive testing at our disposal that we can use to find the exact underlying cause. And this is what really makes us different from the traditional medical model, is that we're doing extensive testing to find out what's causing your issues. And we do different testing depending upon an individual. You may have the same symptoms as somebody else, but we're going to order potentially different testing and do different therapies depending upon what the results come back. So when you can't feel your feet, what happens to your brain? If you remember, I talked about the fact that that information, when it comes up from your feet, goes to your brain and provides activation or stimulation for your brain. That's one of the things your brain needs to be healthy. Think about your muscles. If you don't activate your muscles and use your muscles, they're going to wither away and atrophy or lose their mass. They're going to become very weak. You know, if you've ever been laid up in a hospital bed for a long time or know someone that has, they start to lose the actual mass of their muscle and it becomes very weak because they're not using them. Same thing with the brain. When you don't get that activation from your feet and your hands because of the peripheral neuropathy, it causes decrease in proper function of the brain. And there's a study that was done that shows that when you have peripheral neuropathy, because of the lack of activation in the brain, it can lead to other neurological issues: loss of balance, memory loss, depression, anxiety, Alzheimer's, dementia, and insomnia. So maybe you're experiencing these and other neurological things that you don't think are connected to your neuropathy, but they may very well be. And this is a study that talked about that. So if you cut your nerve, you're going to change your brain. And that's what we're talking about with the neuropathy. We're decreasing the sensory information back up to the brain, thereby decreasing brain function, resulting in a bunch of these other neurological symptoms. One of the things that you'll find in your brain, well, you won't find it, but it's there, is a map. So on the right side of your parietal lobe here, there's a map of the left side of your body. On the left parietal lobe, there's a map of the right side of the body. And so one of the things that we'll do when we do the functional neurological exam in our office is to test that map to see if it's functioning properly. And we'll compare one part of the body to the other and side to side to see how things are working. So what does a neuron, a brain cell, a nerve cell need in order to not only survive and thrive, but also to revive and repair if it's already damaged? It needs fuel, so you need good fuel in the form of glucose and proper oxygen. And so we address those two things in our program. You also need no inflammation. Inflammation is huge. I talked about it extensively. We have to decrease inflammation. You also need good neurotransmitter support. Neurotransmitters are the things in your nervous system that help communication from one cell to the other. And you also need activation. You need lots of it. So as part of the program, we activate those nerves. We get them to function better, fire back up to your brain. That helps to improve brain function. Ultimately, your goal, obviously, is to help improve the symptoms in your feet: numbness, tingling, burning, pain, and that's going to happen, but the brain function is important as well. And like I said, it's just like working out muscles. If you don't activate the brain with the stimulation from the information in your hands and your feet, you're not going to keep that brain healthy and active. We're one of the first clinics in the area to utilize a therapy called HACOMED, horizontal microcurrent therapy, and this is specifically designed to activate and stimulate and get to function better the nerves in your hands and your feet, more importantly, with the neuropathy. This therapy gets phenomenal results in those nerves. You can't do this alone, however. You still have to address all the other components: the fuel, the oxygen, the metabolic concerns, the inflammation. All that stuff has to be addressed, but this is how we start to wake up and activate those nerves and get them to function better. Basically what it does is it stimulates the nerves electrically. It actually blocks pain, so it helps to decrease the pain in the short term. It improves blood flow, which is going to help heal the nerves. It stimulates the nerves from a biochemical perspective as well. It allows for greater metabolism and healing. It reduces that inflammation at the local level, which is extremely important. And there's an alternating current with a constant intensity that allows for a deeper penetration to get into those nerves that are deep in the tissues. The difference between this and all the other types of electrical currents, then there's tons of different electrical currents, is that all have the bioelectrical and biochemical effects on the body. The horizontal microcurrent in the HACOMED is the best and the most state-of-the-art. When the peripheral nerves start to die off, they need to be stimulated, and the HACOMED horizontal therapy is the best out there. And I've tried other ones. This is the best that is available. I have a network of hundreds of other doctors that I belong to. They've all used not all of them, a lot of them have used the HACOMED therapy. They get phenomenal results as well. What else do we need to do for nerve activation and repair? We use a class 4 low-level laser therapy. It's by cutting-edge lasers. It's known as a cold laser. This is actual picture of that laser in our office. You can see it's being used here for low back issues. So remember, we talked about if you have stenosis, degeneration, bulging disc in your low back, that could be contributing to the neuropathy. We may use the laser directly on the back to help reduce some of those effects. We can also use it right on the feet or on the peripheral nerves going down to the feet to help with that repair. It decreases inflammation, decreases pain, increases energy production down at the cellular level in the mitochondria, which helps stimulate healing. So this is another component and a key one to our program for peripheral neuropathy. How does the low-level laser work? There's a specific wavelength that has been proven to go into the nerve cells and stimulate energy production, allowing the nerve to heal. I kind of talked about that. It also stimulates microcirculation and lymphatic drainage. So if you've got any kind of edema, swelling, that also helps to bring that down, because it stimulates the circulation in through the blood vessels and circulation out through the lymphatic drainage. What else is done for activation and repairs? Just a review. We do HACO-Med horizontal microcurrent therapy, class 4 low-level laser therapy. We also do vibration with oxygen therapy. So oxygen is needed for energy production in the cells. And so vibration will stimulate, in addition to stimulation by the laser and the microcurrent, vibration actually stimulates those large nerves in your feet that go up to your brain and activate it. So we do that at the same time you're doing oxygen therapy. You know, I have a book here, it's called Stop Aging or Slow the Process. It's written by a medical doctor. It talks about the importance of exercise with oxygen therapy. It helps your body to use oxygen more efficiently at the cellular level. And so we do that in combination with vibration therapy as one of the components of our neuropathy therapy protocols. Vibration stimulates the large sensory nerves, which I talked about, and it delivers fuel, oxygen, for healing, which is necessary. You're also going to get an at-home rebuilder therapy. It's a peripheral neuropathy rebuilder therapy machine. As part of our program, you get that machine to go home. So in between your visits to the office, you're continuing to do this stimulation of those nerves in your hands and your feet to get them to continue to improve and heal. And when you're done with the program, you actually get to keep that so that we can maintain the results that you've achieved throughout the duration of the program. The rebuilder therapy, you do that daily at home, and it helps to restore the connections between the peripheral nerves. And it's yours to keep, as I said. You use it after we're done here in the office and you've gotten the results that you want. You want to maintain those results so you can keep that at home. That's yours as part of the program. The rest of the program, of course, we're going to be making very specific lifestyle, dietary modifications and recommendations that's based on your testing. Nutritional supplementation is a part of the program as well. We don't prescribe any medications. If you're looking to get off medications, that can be a goal, but we need to work with your prescribing provider. Do not stop anything unless you've talked or consulted with them first. But we use nutritional supplementation so that your body is functioning as best that it can. A couple key points to review. It takes many different things to correct peripheral neuropathy. Doing one thing only is not going to cut it. There's many different components to it, so they all have to be addressed. And maybe you've tried some things before in the past, maybe things that sound similar to what we're doing here, but you haven't done it all in the past. And when you don't address all the components, you don't get the results that you're looking for. So you have to address both the underlying metabolic and neurological problems in order to have success. This condition is progressive, so it starts out slow. You didn't even realize it was happening in the beginning until you started having maybe a little bit of numbness, a little bit of tingling here and there, and it gradually got worse and worse. Now it's going to continue to get worse and worse. If you've got diabetic neuropathy, peripheral neuropathy, eventually you're going to have amputation of your toes and your feet and maybe legs. It gets really serious in that regard. Our peripheral neuropathy program is the most comprehensive and state-of-the-art here in the upstate. And so if you've tried other things before, you've not had one that's as comprehensive as what we have in our office. Another summary, looking at the blood work, the functional ranges we use to identify the underlying metabolic conditions. Inflammation, blood sugar, cholesterol. This is the most comprehensive blood panel you've ever had. I guarantee it. We put you on an anti-inflammatory diet to allow you to heal. And then we activate and heal your nerves using the HACO-Med horizontal laser therapy, class 4 laser therapy, HACO-Med microcurrent therapy, the class 4 laser therapy, vibration with oxygen, lifestyle changes, nutritional supplementation. That's what we do. So, how bad are you? How do we determine how bad it is? We use an objective assessment measure. So when you come in for the neurological evaluation, we're going to use what's called the Peripheral Neuropathy Toronto Scoring Test. We do a bunch of different things to assess the function of your nerves. We say, hey, does this feel like this? Does this feel like this? Is this as warm as this is? Is this the same vibration as that is? A bunch of different things like that. And then there's an objective scoring system. A normal score is 74. Question is, what score do you have? Most commonly, we'll see scores in the 30s and 40s, which means you've lost potentially 50% or more of the nerve function. We then use that as a follow-up to demonstrate the improvement in those numbers as you go through the program. So we'll do that on your first visit. We'll do that Toronto scoring exam. Okay, so if you've liked what you heard so far, the next step is you need to make an appointment. I can't do anything for you while you're sitting on the couch there watching the video. You have to come into the office so I can evaluate you from a neurological and a metabolic perspective. Once we do that, then we can figure out, number one, whether we'll accept your case or not, and then number two, what we need to do going forward to get you better and change your life. On the first visit, when you come in, I'm going to review your case. We're going to talk about any existing blood work that you have. So if you have some recent blood work that you've had done, bring it in. I'll show you how not comprehensive it is compared to what we need to order. We'll do the functional neurological exam. We'll do the Toronto scoring exam. And then on the second visit, if we accept your case, I'm going to review the neurological findings. I'm going to review the metabolic findings from the blood work. So remember, on that first visit, we are going to order blood work. I talked about the cost of that already. And then at that second visit, we're going to make recommendations for what therapies you need to get your life back. We'll talk about the financial obligations all the way down to the nickel at that point as well. You'll have different options to choose from. So we do the best that we can to work within your financial means, to work within your budget. If the options that we present don't work for you, then you just come back and say, hey, this is what we can do. You know, how can you make that work for us? And we try to work with any budget that you bring to us. So the offer for today to make an appointment. Normally the appointment is $300 for that first and second visit total. That does not include the blood work because we have to pay that money to the lab, so that's separate. To make the appointment for all the services in our office for those two visits, normally $300. If you call today, you make an appointment, it's $99. We do request that you pay that in advance so that we can reserve that hour for you, so they will request payment over the phone. We only accept 8 new peripheral neuropathy patients per month. There are multiple different therapies you're going to be doing in our office. It takes a lot of manpower to make sure that you get the quality care that you need. We help people with other conditions. I help thyroid patients. I help kids with neurodevelopmental disorders. I help patients with diabetes, all kinds of different things. A lot of different chronic conditions, so we only accept a certain number of each ones each month. So you want to get in, make your appointment so that you can be one of those 8 this month. Couple of requirements. Your health has to be your top priority. So if you're helping mom or dad or grandparents or kids with their health, that's important. You need to do that. So just call and make an appointment when you have the time and availability and focus to pay attention and work on your own health. You have to bring your significant other to your appointments. It's an absolute must for that second appointment in particular. So when we go over the report of findings, I'm going to tell you what's wrong. I'm going to tell you what we need to do. I'm going to tell you what the exact costs are. We're going to ask you to make a decision about what you want to do going forward, whether you want to change your life or you want to kind of stay where you're at and do nothing. You have to bring your significant other to that appointment so that those decisions can be made based on the information that we talk about. You have to have the right attitude. If you feel like you're not ever going to be able to get better, and no matter what you do, don't make an appointment. Because if you don't feel like you can have improvement, then that's going to be the first obstacle to you actually getting better. If you don't feel like you can make the changes that we need you to make in terms of lifestyle and dietary stuff, don't make an appointment. I don't want you to waste your time and energy. Don't waste my time and energy. It's not going to be successful for you if you're not willing and committed to doing what you need to do. You have to take personal responsibility for your own health. As I said before, I can't care more about you than you care about yourself. I spend thousands of hours and thousands of dollars educating myself every month. Almost, I'm going somewhere to learn something new so that I can help you in the best way possible. And so I do all that I can so that I can offer my patients the best opportunities to gain their health back. You have to step in and take responsibility at this point. If you're not willing to do that, then again, I can't care more about you than you care about yourself. There is a time commitment involved. You have to do the therapies in the office. They're extremely important. The laser therapy, the Hakamed therapy, consultations for nutritional recommendations, dietary changes. You have to come to the office for that stuff. So there is a time commitment involved. Insurance. Everything we talked about, the Hakamed, the laser, the nutrition, dietary stuff, all that stuff is outside the traditional medical model. We're not talking about just giving you a script for Lyrica or something like that for your pain. We're talking about serious commitment here in terms of these therapies. They are outside of the traditional medical model, so when you step outside that model, insurance doesn't pay for it. I told you that up front. Most people can get the care that they need, however, for anywhere between $200 and $400 a month. We have different financing options. You can take that all the way out to 18 months with no interest. The actual amount will depend on what you need as an individual and how long you choose to pay it back. But think about this in terms of a new car, okay? Or even a used car, nice used car. You're going to pay somewhere between $200 and $400 a month for a used car, and you're going to pay that for 5 or 6 years, not 18 months, and certainly not interest-free. Is that car going to get you your life back? No, it's not going to get you your life back. This program is designed to help you get your life back. When you compare it to the cost of a used car, what's more important, getting a nice used car or getting your life back? This is a post I found on Facebook. It's a post of a patient who has multiple sclerosis. It's also a nerve degeneration disease. It's an autoimmune disease that causes that. And the medications are extremely expensive. This cost that I'm going to show you is actually with the insurance paying for it. So it's inside this medical model. Who knows if it's even getting them help or not. But the insurance company is paying for some of it, and then the patient's cost, after the insurance covers it, is $2,079.37 for one medication for 1 month. All right? And who knows if it's actually getting the patient where they want to go in terms of their quality of life. So just keep these things in perspective. We ask that when you make your appointment, you keep your appointment. So if life happens, you need to make a change and reschedule, no problem. Give our office a call. Just give us 24 hours notice. We'll be happy to reschedule you. Make sure when you come to your appointment, wear or bring shorts and a t-shirt. I need to evaluate you neurologically, so I need to see the skin from your shoulders to your fingertips and from your knees down to your toes. If it's cold out, just bring the stuff with you. You can change in our office, no problem. You have to complete your application for care. There's 2 parts to the application for care. There's a paper portion and there's an online portion. You have to fill out both portions. It's extremely important. If you're not comfortable filling out things online, you don't know how to use a computer, you don't have a computer, you don't have internet, I'm going to have to ask you to go to the library, ask a family or friend to help you. It's extremely important that we have this information funneled through the system. It helps me to evaluate what exactly is going on with you so that I can give you the best care possible. If you don't fill it out with all the information, then I can't help you the best that I can. The application for care, online and the paper portion, is going to take you a significant amount of time. It's going to take you most likely an hour or more. If you look at that and say, oh, I'm not doing all this, this is too much, then you're not committed to getting better, so don't even make an appointment. Please take the time to fill that information out completely. You're going to have to watch this video with your significant other. So if your significant other is not sitting on the couch next to you right now, you're going to have to rewatch the video with them before you come to the appointment. It's extremely important that they have the background information necessary to help you make a decision about getting your life back. If they don't know exactly what we're going to do, then they're not going to be able to support you. The only alternative is they're going to sabotage you, and that's not going to help you get better. If you miss your appointment because you didn't give us 24 hours notice, you didn't have your paperwork finished, or you haven't watched the video with your significant other, we will reschedule you. You'll have to pay the reservation fee again, the $99 again. We won't charge you the full $300. You just pay the $99 again if you don't have those requirements finished. And we do have a waiting list. Like I said, if we reach our maximum number of people in a month, then you'll have to get put on a waiting list for the next month. And sometimes we're booked out for new appointments even a couple of weeks. So if you get all your paperwork done, just get it in, and then if we have an opening, we can slide you in and get you in sooner. Okay, it's really important for you to take action. Like I said, I can't do anything more for you unless you get up off the couch and call us and make an appointment. Knowing and not doing is like not knowing at all. So I gave you a lot of great information today, but if you don't do anything with that information, you're certainly not going to get any improvement in your quality of life. You know, Einstein said the definition of insanity is doing the same thing over and over again, expecting different results. If you stay inside this medical model, taking the medications over and over again, expecting to get improvement, it's not going to happen. You have to step outside this box, try something different. If you try to stay inside there, it's insane, literally. If you're sick and tired of being sick and tired, and that's where people are when they get to our office, they're just sick and tired of feeling this way, think about how it's been impacting your relationships. What's it already cost you in time and money and happiness? You know, what's it going to look like in 3 to 5 years if you don't get it changed now? And the reason I ask this is because I looked down at the scale a couple of years ago and I saw a number I'd never seen before, didn't want to ever see again. And I literally asked myself, you know, what's this going to look like if it keeps going up in this direction? And I didn't want to find that out. So I decided right then and there, you know, I'm going to make a change in my life. I've lost 30 pounds since then, and it's been phenomenal. And then what's it worth to get your life back? And really, for most people that come into our office, this question has nothing to do with the finances. It has to do with the commitment level to making the lifestyle, dietary, time commitment, all these changes in your life that need to be made in order for you to be successful. When people get the results that they get in their office, the financial investment that they've made really becomes not a concern at all. Like I said, a lifestyle change may mean for you that you have to stop eating a particular food forever. Let's just say it's gluten, for example. That's breads and pastas and things like that cause tons of inflammation. If we say you can't eat these things anymore, you have a choice. You can eat them and feel terrible. You can stop eating them and be on the path to healthier living and improved quality of life. That's a choice that you have to make. Where are you on a scale of 1 to 10? 10 being, I'll do anything I need to do to get better. 1 being, you're not even watching the video if you're at a 1, so congratulations, you're at least a 2 or more. If you're an 8, 9, or 10, you're most likely a good candidate for the program. So if you're an 8, 9, or 10 in terms of doing whatever you need to do to get better, then go ahead and make an appointment. We will most likely accept your case. And then what's your reason why? What 3 things could you do in the future when you get improvement in your symptoms that you cannot do now because you just feel so terrible? Those really need to be the driving force behind you getting better. I want to be able to golf. I want to be able to get down on the floor and play with my grandkids. I want to be able to take a walk with the dog. I want to be able to do vacations and hike and all these things that I can't do now because I can't feel my feet. I'm falling over, I'm clumsy, I'm overweight. All these things are contributing to you having a poor quality of life. What things do you want to be able to do? Keep those in the back of your mind and you can be very successful. Okay, so the next step is to make the appointment. Give our office a call, 864-757-8500. You can also get more information at our website, renewingfunction.com. Thank you so much for taking